Omicron variant is now the dominant COVID-19 variant in Ontario. That is the latest projection from the province's Science Advisory Table. And its chair, Dr. Steiny Brown, says the way forward is to pursue an aggressive booster shot campaign. He is also calling for capacity limits, which we saw from the province yesterday. CBC's Megan Fitzpatrick is on the story live from Toronto. This news conference, with all its graphs and all of its findings, what really stands out from that, mountain of information, Megan?
I think just the prediction, Sue Hannah, that we're really going to see case numbers start jumping up in Ontario. Steiny Brown is predicting that this is likely to be the hardest wave of the pandemic, he said. I'll just step back and start reviewing some of his key findings from his presentation. One of the main messages here is that the Omicron variant is very, very transmissible, way more so than the Delta variant. And the Delta variant was already pretty contagious and transmissible as well. And that's why we're going to see just the sheer number of cases start jumping up very rapidly here in Ontario. One of the other key findings from the science table was about vaccine effectiveness against the Omicron. So the slightly not as good news on this front is that the vaccines seem to be a little less effective against preventing infection of COVID-19, which is why we're probably going to see more so-called breakthrough cases of fully vaccinated individuals getting COVID. But the good news is that once people start getting their booster shots, their protection will substantially increase against Omicron. Steiny Brown said the 2 doses of a vaccine still probably pretty good protection, but depending, on how far out you are from your first and second doses, will dictate your protection level. So it's really key to get a booster dose as soon as possible, Dr. Brown was saying. Now, in terms of what we might see in our hospital system and our intensive care units, Steiny Brown was saying we are likely to see a substantial rise in hospitalizations and people ending up in ICU with COVID. We've already started seeing an increase in hospitalizations here in Ontario, but a 25% increase in the last few weeks. And that's even without the full impact of Omicron hitting us yet. So they're predicting that ICU capacity could jump up above 500 people needing ICU beds in January. And this obviously is concerning for a number of reasons, Sue Hannah. The strain it'll put on our healthcare system, the strain it'll put on our healthcare workers, who are obviously already exhausted and burnt out as well. He is saying, they're still learning a lot about Omicron. There has been, some discussion of whether it's less severe than the Delta variant. He's saying it may not be mild compared to Delta. He does think it does have the potential to cause severe illness. So quite a few findings in terms of what they know about the Omicron variant so far. They are looking to what's happening in the other countries to try and predict what will happen here in Ontario. But bottom line, we could see cases go up to 10,000 a day by the end of December. That's the higher end of their predictions. The lower end is in the 6,000 range. But again, it all depends on public health measures that are implemented, how strictly people adhere to them, and our vaccination rates.
And what advice does the science table have to deal with the Omicron variant, Megan?
Well, sort of two paths here for advice. One is sort of on the public policy side and what governments should do, and then what individuals should do. So in terms of policy decisions, the science table is saying we need what they call a circuit breaker here in Ontario. And that's really meant to just reduce social contacts. And how do you do that? One way is to cut capacity limits at public places. The government did move to do that yesterday in some venues, like big sports stadiums and arenas, concert venues, theaters, movie theaters, but they don't take effect until Saturday. Steiny Brown essentially said in his news conference, we shouldn't be waiting to cut capacity limits. That should be happening more urgently. And then also he also did say, though, this wouldn't be a full lockdown. When the science table is calling for a circuit breaker, they're not calling for a stay-at-home order, but they are calling for people to reduce their social contacts. And so on the individual level, he was really urging people, well, first of all, and most importantly, get vaccinated. If you don't even have a first dose, go get it. Fully vaccinated individuals, try and get your booster shot booked as soon as you can. As we know, the province is opening up eligibility for third doses to 18 and above starting Monday. It's currently 50 and above. I know some people have been having trouble finding appointments, Suhana, but the government, public health units, hospitals are working on adding appointments by mounting more clinics in the days ahead. So he was urging people to get vaccinated. He said that is a key part of our exit strategy out of this pandemic. Also urging people to avoid crowded places with indoor spaces with poor ventilation. So if you are indoors, try and increase the ventilation, wear a mask and wear it properly, a good quality, well-fitting mask. Now, I think he was asked too about social gatherings, with the holidays upon us and next week. He said really, I don't think he was going to be the one to cancel Christmas or tell people to stay home and not see people, but he did sort of throw that over to Dr. Kieran Moore, the Chief Medical Officer of Ontario. Steiny Brown, co-chair of the Ontario Science Table, was saying people need to think about the circumstances of any gathering. Are people vaccinated or not? Are they immunocompromised or not? Are they vulnerable for some other reason? Where are you going to be doing it? Indoors, outdoors. These are all things people I know are trying to grapple with right now as they try and plan their holidays. Premier Ford yesterday didn't rule out further public health measures. He said he doesn't have a crystal ball in terms of what's going to happen with the cases here in Ontario.
Got to leave it there, Megan.
Maybe just brace themselves for some public health measures coming,
All right.
more public health measures coming.